The year of 2020 has set a lot of us back in our plans and projects, but the United Medical team has overcome these obstacles with our new webinar meetings online. CEO and founder of United Medical, Kamal Erkin, has been hard at work finding new ways to stay in touch with providers, dietitians, and his team to help get accurate and helpful information out to our patients through online webinars. Here's a sneak peek at what we accomplished this year.
Our main focus probably is Delaware, but from the clinical integration. We are doing this, actually we are testing some ways of communicating with our patients days delay. Now from here you can actually see the daily number of deaths, and then you can see the projection of this. Reda and his group has done many events.
Well, I think the key essentially is education, isn't it? Communication. So what you and United Medical is doing is absolutely necessary.
We first started using a program called Doxy.me that we saw the demo on, and we had great success with it. I think it's a very easy platform for the patients. Not necessarily the best on the provider side, but it doesn't involve the patient. They don't have to download any apps. They don't have to really create any accounts.
COVID, as with everyone else, has presented some interesting challenges for us, and the numbers you cited are quite interesting. Obviously we're proceeding at a faster rate than had originally been anticipated.
And I appreciate you, Kamal, for wanting to have the conversation, because I think that's very important, that one of the things that our racial minorities, our ethnic minorities need to know is that they're being seen and their concerns are being heard.
To the patient at every given, at every level. So I think that's really important. So if my parents were on the Medicare plan right now, so because they live in Turkey, so they're not on Medicare, but if they were here and they have Medicare, I would ask them to pick one of the Medicare Advantage plans.
But when I retired from the Air Force, I felt like the use of digital tools and health information technology really had a lot of promise to address some of the things that had frustrated me deeply as a practicing physician all those years.
But aside from education, school promotes social interaction, safety sometimes for some kids, monitoring them for nutritional needs, and of course physical activity. So there's a lot of good things that school does, and you have to balance this with the risk of sending them back to school.
The businesses were frustrated. Certainly the medical community was frustrated by the shifting of medical care, but I think also understood what their sisters and brothers in the medical profession were going through in trying to treat a pandemic. Parents are frustrated with regard to schooling and kids not in school and seeing kids not be able to learn as well. So everybody is frustrated.
The 80,000 that I was sharing earlier, is that the number that you have on your side as well?
So 80,000 is what the federal government advised that we should be doing. I did some preliminary values or calculations on how we're doing per month, and we've been over 80,000 per month since June.
That's good to know.
Yeah, that's very good. So I really appreciate all the partners. It's not just DPH, there's other state agencies involved, as well as hospital partners and community partners. So it's really an entire state participation getting our numbers as high as they are now.
Cover the digital health, which becomes there's always a good, some good outcome of the crisis that we go through. What we can learn, what we learn, and what we can quickly adapt and change. And I believe digital health wouldn't have this much improvement if we didn't have a pandemic. Given any type of order, we are following up with those orders. So as soon as the COVID-19 started, we incorporated the follow-up for COVID from our central office. So what we have here is our wonderful office, decorated by our team. They did a really good job this year.
And that is a potential positive. That could possibly be a case that we were concerned enough to place the order, but now they're not following through on it. So therefore, they very well could just be as positive. So you'll see.
COVID-19 pandemic is a public health crisis. As of December 2020, more than 315,000 people lost their lives in the United States alone.
My life is at stake. Isn't the choice obvious? I will get the COVID vaccine.
Say that we are in favor of getting the COVID-19 vaccine.
Get the COVID-19 vaccination.
And I'd like to share with you my thoughts on why I will be getting the COVID-19 vaccine as soon as I am able.
Today, I am happy to tell you that I am looking forward to get the COVID-19 vaccine as soon as it is available to me.
In today's video, we'll be covering insurance, a riveting topic I know, but in this line of work, it's important to be familiar with it. By optimizing how insurance claims are processed, United Medical can help our clients receive higher payments for claims and in a timelier fashion, which is a huge benefit to any medical practice.
So we're going to be talking about diabetes throughout this whole series. This is part of our diabetes program as outreach.
Now, since we've had COVID, it has affected many people in many different ways.
It's so important for us to get the word out about why it is important to care for your feet.
I myself in my practice like to focus a lot on preventive care because it's, even though we treat heart disease and vascular disease.
So as a patient, what I really want to know is that what can my doctor do so that I know that how kidneys are getting.
One of the typical things I like to tell shoppers too is everyone's seen my plate and how sort of our food should look, as half our plate should be fruits and vegetables.
Because of the holidays, we talk about diabetes. So all the different aspects of diabetes, your heart, your kidneys, your feet, your eyes. And today,